Okay. We're live. And I've just remembered that I haven't got my microphone on. How are you doing? Welcome. Another Sunday, another live stream. I hope you guys are doing well. Thank you so much for joining me. How are you doing? It is extremely hot where I'm sitting. And I've got the fan on with the lowest cycle I can manage, that the noise from the blades doesn't affect the audio here. So bear with me. I've got the window open as well, so there might be a little bit of noise from the road outside, and then the other door is going back and forth, so all sorts of sounds. But it's great to be with you tonight. My name's Dr. Sylvia. I'm a general practitioner. This is AskAwayHealth, where we discuss everything medical, and I've got a few interesting things to talk to you about. But as you come in, please give this video a like. And for those on YouTube, hello to those from Facebook and LinkedIn. Thank you so much if you're watching and just meeting me for the first time. Really great to have you on board. But for those on YouTube, there is a poll. Given that the weather has been very warm in many places, I don't know how it is where you're watching me from, but the topic is around dehydration. I'd really love to know what you think, and please answer the poll. I think what it says, let me just read it out here. Yeah, what is a good way to treat mild dehydration? So let me know what you think about that subject. It's got 4 different options. I would love to hear from you. So we've got a packed show this evening. We're going to be talking about some ideas around extending fertility. We're going to be talking about hyper-personalized AI. What is that? If you've heard of that before, please let me know in the comment section. If you haven't, just put a question mark. That's fine. And then, of course, we're going to look at a question that's been posed recently by one of my viewers on the channel. But before we get into that, let me just go through a few of the things that we've published recently on the channel. I really want to do that to encourage people who may not know about those videos that are up on the channel, and just encourage you to go and check it out. You might find that it's something that will be relevant. So I'm just going to share my screen, so hopefully you can see this. In the last week we've published 3 videos, and one of them is on menopause fatigue, which I think a lot of people have I think quite a few people have seen that, and I think it's quite interesting, sharing tips on how to overcome fatigue during menopause, describing how menopause fatigue is quite different from tiredness as a result of other things. Tiredness is tiredness, yes, but there is something sort of different when you're undergoing menopause and experiencing fatigue. But just being able to recognize that is important and can be one of the first steps towards improving or towards solving the problem. So we tackle tips, we look at the causes, we tackle effective tips to be able to combat that, and help you get stronger when it gets to dealing with fatigue around menopause. Then the other video that we talked about is most effective fibroid drug treatment. Now, this was a very interesting video that I was working on. I really wanted to answer that question because I get it a lot. What's the best drug to use for fibroids? And there really isn't a single one answer. There isn't this is the best. It all depends on a set of different circumstances, because women with fibroids, we have different we're in different categories, different ages, some people have had their kids, some people haven't, some people have different degrees of symptoms, some are moderate, some are severe, and so on. So depending on what issue that you want that your treatment is geared to, or depending on what problem that you're dealing with, will determine which is the best. But what I've done is I've put out about 8 different treatments that are available at the moment, and sort of ranked them in the way that they deal with fibroids, whether it's dealing with symptoms like bleeding or pain, or whether it's dealing with problems like shrinking the fibroid before surgery and so on. So please go ahead and watch that video. It's just a few days old, and I think it will be very helpful for anyone who's interested in that subject. And the most recent one is I was testing an over-the-counter, that's this one here. I was testing an over-the-counter vaginal discharge kit. And again, how did I get into this? Well, there's so many different ones out there, and many times there are different types of vaginal discharges. And, sometimes you just want to go to the chemist or the pharmacist to just check out what it is that's going on. You're not ready to get to the doctor's office. And so I was asking the question, is it really is it really worth it taking that sort of triangular route, go to the chemist first and then the doctor's office? Why don't you just head straight to the doctors? But anyway, anyway, some people do it. And I wanted to have a look at these testing kits to see how well do they do what they do. So if you want to know what my findings were from that experiment, please go and check out that video looking at over-the-counter vaginal discharge testing kits. How reliable or how effective are they in trying to identify that there is a problem? I think that's the basic, trying to identify that there's a problem, even though we do say that with different types of vaginal discharges, you can tell from either the appearance in terms of the color, the thickness or the thinness, or even the quantity, the smell, and so on. The presence or not of other symptoms like pain, pelvic pain, feeling unwell, fever, all those sorts of things can clue you into the fact that this is not normal. But in the instance that that's not there or that doesn't, then perhaps this kit could help somebody identify that something's not right and I should go and see my doctor. So if that sort of piques your curiosity, please go and check out that video. So that's what's been going on the channel, on the YouTube channel for the last few days. I would really appreciate it if you would check it out. Please drop a comment on the videos. You're always welcome to do so. And of course, a question if you want to. And speaking of questions, this is just the opportunity for me to put the disclaimer up here that I'm engaged in providing health information and as much as possible signpost people to the best evidence, the best resources to help to deal with their health. It's not appropriate for me to try and dish out medical advice on here because that depends on so many different things which I don't have access to here on YouTube. So please, everything that we say here is information that should help to guide you to think in a particular way, and encourage you to go and sit down with your own practitioner who knows your medical history, who knows your medical background, and will be able to give you the right advice. Excuse me, will be able to give you the right advice for whatever condition that you want questions answered around. So thank you so much for watching. Thank you for joining me. If you're here, let me know where you're watching from. Great to have you here. Thank you so much for clicking on. Let me know where you're watching from. Have you answered the poll? If you have answered the poll question, please give me a thumbs up as well. And yeah, we're going to be talking lots of different things, and it's always great to hear from you. Let us take a quick break before we go into the first segment for today's program. Oh, fantastic. So back, right. So we're going to be looking at a few things. And before I forget, I have recently published a few free guides on a variety of topics. Of course, the most recent one happens to be the guide on effective fibroid treatment. That's literally hot off the press. I think it was just published last week. And what this is a free downloadable guide. So if you've watched the video and you want more, or you want just a little, it's like a little snapshot of the information in the video, and you can just have that and download that onto your phone, and you can sort of look at it. Perhaps that can help to spur that discussion and encourage with your doctor about the different fibroid treatments. So if this is something that you're interested in, please download this. The link to this tool, this guide, is in the description box for this video, so make sure you have a look at it. One of the older ones, of course, which I've talked about before, is vaginal dryness guide, and this is one, it's sort of like a checklist or tool that you can sort of work your way through one point to the other, what to do if you're experiencing vaginal dryness around menopause. Again, the link for that is also in the description box, so please check that out. And I think they've got a few other tools and trackers and guides that could be very helpful in different, women's health conditions. So I just wanted to remind us about that before we get started. And quote of the week is something that I really want us to get into on this channel going forward. So if you've got a quote that you think is quite relevant, please share with me in one of the comments to the community post on one of the videos, and I'm going to feature it. But this week is coming from one of the articles we're going to be looking at in a few moments. That is, health is also what happens between doctor visits. I don't know who is credited with this this quote. I really don't know. But I think this is really interesting because people sort of think about doctors mainly when mainly when something goes wrong, when there's an illness and there's a complaint, which is, yeah, fair enough. But health is actually what is going on in between doctor visits. It is, what are you doing to keep yourself healthy? What practices are you undertaking? Are you picking up more health information? Are you eating right? Are you exercising right? Are you making choices to keep you healthy in between doctor's visits? And I thought that quote actually captures that kind of sentiment and how important it is to be aware of things like that. So, right, let us get into the very first discussion. And this is around something I find very curious. So we're now in this segment, what I call Have You Heard Of? Okay. The very first Have You Heard Of I've got for you. The very first I've got for you is, have you heard about this drug that could extend women's fertility by 5 years? If you have, let me know. Please let me know in the comment section if this is new to you. So I'm going to be sharing my screen again, and we're going to be looking at this article that I found. And this is it's not a brand new drug by any means. Okay, it's not new in that sense. It's something that's been there for, I think it was actually discovered, 20, 30, no, my maths is out now, probably about 35, 40 years ago. And of course, it's got different is developed. It's been developed for different conditions, as you'll find out. But this article that says a drug could extend women's fertility by 5 years. Now, I would love to hear from you guys as we go into this, because when we're talking about fertility and fertility issues, this is a very sensitive issue. This is something that is a big problem for a lot of women and men, so for a lot of couples. And how do we deal with fertility, or let me say infertility? How do we deal when it's at a point where a couple are seeking to have a child and are having challenges? How are we dealing with those things? Or how do we try to put ourselves in a position to avoid fertility challenges in future? So natural approaches that you will hear will be about a healthy diet, food that is rich in antioxidants, fruit, vegetable, whole grain, and so on, to help to protect the egg and the sperm. So those are natural practices that you will take up. Then of course you are encouraged to maintain a healthy weight, because being overweight and underweight can contribute to fertility problems. We've talked about antioxidants, so eating food that's high in antioxidants or omega-3 fatty acids, things like fatty fish, nuts like walnuts can help to improve your fertility. Dealing with stress, cutting down things like caffeine, alcohol, not smoking, and so on. Those are things that you can do. Of course, medical interventions, we have fertility drugs like Clomid that we can take to stimulate ovulation, assisted reproduction, IVF, we have that hormone therapy, and different surgical procedures, depending on what the problem is. But here we are talking about a drug that could extend women's fertility. Now, this is the claim. This is what the scientists are saying, that this drug could extend women's fertility by 5 years by slowing down the rate at which the ovaries age. So this is the premise. This is the theory. This is what the researchers are working on. It is a drug called rapamycin. I don't know if you've heard about it. This drug currently used for treating cancer, also used as an anti-rejection drug for people who've had kidney transplant. So this drug is quite well established, but it's also really interesting. When I read this up, it's also the most effective, where is it now? The most effective life extension drug. That is amazing. It's the most effective life extension drug. So potentially for extending life. The theory is that it has the ability to slow down the beginning of diseases that are common as people grow older. So that means that it can potentially allow people to live longer, improve the health span. This is really interesting science that we're talking about. And while this study that I'm just going to describe to us now is looking at ovaries and fertility, I just want us to sort of, think ahead. And I really love to hear your opinion when you're watching this, whether it's now or in the replay. And do you think that science is we're just dabbling and dabbling and dabbling? Are we going too far when it comes to these things? Because on the one hand, you can see the benefit. Okay, you can see the benefit, but on the other hand, are we just dabbling too far? I'm not going to read the whole article. Okay, you can go and read it later. I'll put the link in the description box for you. But some of the things that this drug is doing. So these are some researchers in the US, in Columbia University in New York, and they're studying rapamycin, this drug that can, slow the aging of the ovary. Okay. They say that they're finding very promising results. Initial findings suggest that they can decrease the ovaries aging by 20%. And not only by such a significant amount, 20%, that's quite significant. Not only by that amount, they're also finding that it doesn't have significant side effects, that people actually involved in these studies are reporting improved health. I mean, we've always been saying that, wouldn't it be nice if you could have that kind of elixir, something that you can drink, a tonic that you can take, and you will feel 20 years younger? I exaggerate, but this comes close. So the scientists say that there are very promising early results when it comes to this thing. They have a study that they've actually started. It currently has 34 subjects, even though they are hoping to expand it to 1,000 participants. Currently, they're about 34. And what they're getting is every week, they're getting a small dose of this medication for a period of 3 months. I think it's really important to say, and of course, when you read the entire article, we've said that this drug is used for treating cancer. And remember that when you're using a drug to treat cancer, you're killing cancer cells. So you have to ask yourself, how is this drug that is killing a group of cells, how is it going to extend life? And that's in the special way that this drug works, which I don't want to go into that because it's so complicated. But they're using a much lower dose than is used in treating cancer, or if they're using it as an anti-rejection drug for people with kidney transplants. So the hope is, if this works, if this study shows such outstanding good results and there are no significant side effects, and this becomes reality in the next, I don't know, maybe 4 or 5 years, who knows how soon this might be reality, it could give women more control over their reproduction and potentially improve overall health. Now, there are 2 things I want to say about this. And I was at this show earlier in the year, Decoding the Future of Women, organized by Femtech Lab in London. I think that was in June, early June. And I was just blown out by the different startups presenting new technologies for all supporting women's health. And of course, that transcends to general health, actually, but around things like menopause and fertility and sexual health and so on. Really amazing meeting. But there was a great presentation by a specialist, a molecular biology specialist, talking about optimizing female aging with ovarian longevity and biotech. So all that really boils down to not just looking at the ovaries as a reproductive organ, which they are, yes, but there's so much more that the ovaries do. They're involved in so many other aspects of the body. And without knowing so much of the science, you can actually link it to the fact that by the time ovarian function starts to decline, then women are experiencing a lot of health conditions. And so some of the questions we're thinking about then is, why is it that the ovary declines so quickly? The decline of the ovary just sort of, it snowballs, if you like. And, somebody said that we should even consider them as a pacemaker for aging in women. And I think that the ovaries are not just important when it comes to reproduction in terms of women's aging overall. So if you have a drug that potentially, without significant side effects, could delay that process, it's a plus, isn't it? So now I would like to hear where you stand on this divide, because I know there'll be different opinions. Some people will think maybe we're dabbling too much in the science of these things. Some people may think that, oh, stop messing with life, stop messing with nature, isn't it? That's the argument that you will have. But then the other side of the divide will say, well, there's some people who might experience, through no fault of theirs, of course, might experience challenges that lead to early menopause and early ovarian decline, maybe in their 20s or their 30s. And if this drug could make a difference to them, why not? The other thing that I noticed in this study, and of course, when they've completed their study and they're reporting it, there'll be an opportunity to ask these questions. What I noticed was that they're providing this for women in their late 30s. So it's women in their late 30s, I think it's from 35 onwards, who are in this study, who are the participants of this study. And so we're not seeing that women in their 40s or mid 40s are involved in this. And we have to look at, why. Of course, the quantity of eggs and the quality of eggs, of course, is a lot lower in the mid or late 40s compared to the mid 30s. Yes, so then that will definitely have something to do with it. But guys, watch this space. I love to bring out this kind of information that suggests what could happen in the next 10 years, what options we have for treating women's related issues in the next 5-10 years, and see where are we going, and think about the ethics of it as well. So, two sides of that divide. I would like to know what you think. Let me know in the comment section. We're going to take another break and then we'll come back to the very next feature. Thank you so much for sticking with me, and welcome if you're just joining in. I'm so glad that you're here. Please give this video a like, and I would love to know where you're watching from. So drop a comment in the comment section. It's always great to hear from you. So we've got a whole raft of different things that we're conversing about today. Now is the time of hyper-personalized AI. So in this segment, which I'm calling "Have you heard of?" The next "Have you heard of?" is, have you heard of Thrive Health AI? Or any type of hyper-personalized AI coach? Have you heard the concept, and what do you think about the concept? So let me share with you my screen again, because I came across this very interesting article. The long one, we're not going to read the whole of it again, and I'm just going to, relay the nuggets. I think the key things, and there's a lot of interesting things here, but I'll just relay some of the most interesting ones. But this is from the Times, and it's titled "AI Driven Behavior Change Could Transform Healthcare." Well, you would have to be under a rock, or maybe, I don't know, just not keyed into the news for the last 5-6 years not to be aware that, of course, AI is having some kind of influence or some kind of effect on healthcare. There's so many things that we're using AI for when it comes to health and science, talking about developing new drugs, diagnosis, making different types of progress. And they're not stopping anytime soon. Scientists and people that are thinking are wanting to see how best can this tool be leveraged to help people just live and lead better lives. And so we've got this article that's written by Sam Altman, who's the CEO and co-founder of OpenAI, and Arianna Huffington, who I think founded Huffington Post. I might be wrong, but I think she used to be part of the either the founder of or the editorial team, but she's now the founder and CEO of Thrive Global, and is very much interested in what I know. When reading a lot of the posts that she provides, and sort of looking at the thoughts, she's very much interested in making, how can we make progress? What little things can we do? What little changes can we do to thrive? That is essentially what she's interested in. So they've come together to look at how a hyper personalized AI coach can be developed, and they're actually doing it. It's actually in the pipeline. It's not something that I don't think it's too many years away. I think it's something that we might be seeing very, very soon. And it's something called Thrive AI Health, is the company that they have come together to fund and to found. And what they want to do is to build, listen, is to build a customized, hyper-personalized AI health coach. Excuse me. And that will be available as a mobile app. And it will be trained using the best science. They're going to use behavior change methodology, because let's think about it. Behavior change, all the things that you need to do to sleep better, live healthy, be healthy, a lot of it does have to do with changing behavior. Dropping bad habits, stop smoking, cut down the amount of coffee or alcohol that you're drinking, cut down the amount of processed food or high carbs and all that. A lot of it is behavior change. Maybe we don't manage stress well. Maybe we don't sleep properly because we are up, at odd hours of the night, or we're not prioritizing sleep. Again, it's about behavior change. So this premise, this idea of the hyper-personalized AI coach is based on something that would help to provide you with prompts to behave in the right way to achieve the desired goal. Now, of course, initially to be geared towards people with chronic disease, at least that's what they say. So perhaps somebody with diabetes and they're having problems controlling their diabetes, controlling their sugars, or trouble with their cholesterol and so on. This tool, this AI coach, will be fed with information about your system. So you program it, or to be programmed with information about you, your likes, your dislikes, kind of food that you like to eat, your age, your weight, and all sorts of things, programmed with your most recent blood tests and other medical data. So it will know you. It will know you as well as you know you, if that makes sense. But what it will also do, because clearly, if it's knowing you, it learns your preferences, your patterns, and how you would react. Because think about it, when you're using something like ChatGPT, and the benefit of ChatGPT in terms of being able to quickly access preloaded data. So now, if you think of applying that in terms of your own personal healthcare, it's about identifying what is it that Sylvia does that prevents her from getting to bed at 10 p.m. or whatever it is that is ideal for her. What is it that when she's supposed to have this healthy meal, she instead decides to go and have a bag of Doritos crisps instead? It's identifying those kind of patterns. So it identifies the things that allow you to get good sleep. And I'm reading directly from the article now. It identifies which foods you love and don't love, how and when you're most likely to walk, move, stretch, and the most effective ways for you to reduce stress. And this is where we're talking about the customized, hyper-personalized. So when it's combined with a superhuman long-term memory and you have a fully integrated personal AI coach that offers real-time nudges, pokes you, that's sort of your conscience. Because many of us, we're not listening to our conscience. So this is supposed to give you that physical poke to do something that perhaps you wouldn't have done. But my question is, it's on both sides of this thing. I can see the value, I can see the benefits of this thing. I can say it not just for somebody who has a chronic health condition that they're trying to control. So perhaps somebody with diabetes who needs to control their weight or to lose weight, and you want them to remember that they should maybe take a 10 or 15 minute exercise or walking break during their day. And so this coach is programmed to identify when is the best time during the day that this individual can do it. So it's convenient. It's not a chore. It's something that naturally happens. I can see the value, but I can also see the other side and somebody asking, why you're making something that knows me almost as well as I know me. How dangerous could that be? And I think it's a conversation that we need to have, just as we've been saying about AI and having these conversations. But what do you think? First of all, have you heard about this? How far away do you think we are from this kind of development? How far do you think we're going to have this app? How far do you think? Is it a couple of years, a couple of maybe a few months, or maybe a decade? What do you think? Let me know. Let me know what you are. You likely to use it, or do you think these people are playing God? What are your thoughts? Please share with me in the comment section. So guys, we're looking at a few different topics this evening. I hope they're of interest to you. Let me know what you think. I hope you guys are doing well. If you're just joining, I can see a few people sort of lurking in the background. You're very much welcome. We're having a little bit of a conversation about recent findings, things that are into the future, thinking about how healthcare might be for might look like in the next 5 or 6 years, and it would be great to hear your thoughts about them. So I'm going to take another break, and then we'll come back with the next feature for tonight's show. Okay, welcome back. So, menopause, and if you live in the UK like I do, and I think it's also the case in many other countries, we are talking a lot more about menopause. Brilliant. That's fantastic. We need to continue having discussions around menopause. But you know how it is when sometimes, we start doing things, or we get a conversation going, and sometimes parts of that conversation may speed off and go, too far or too quickly in a particular direction. This next subject that we're going to talk about, I think touches that a little bit. I know that there are some people who feel, HRT, not just concerned about HRT. I would prefer natural treatment. Is there something else that I can have that is not HRT? There's some people who think that when I say we, I mean medical practitioners, are just shoving this HRT down their throats, which is not the case. Absolutely not the case, because in terms of menopause and symptoms and treating symptoms, if you have them, if there are symptoms, there are different options. And actually, we practitioners are trained to look at the entire body and think about the holistic approach. It's not just you sit in the chair and say, oh, I think I've got menopause, and we have that back and forth, and then we stick you with the prescription. That's just not it. There is also the lifestyle. The lifestyle approach is so important. And that's why I'm really glad that when I came across this story, because I think that it is one that many women, of course, I think will be very happy to hear. This is Women's Health Chief says, I hope you can see my screen. Okay, good. It says Women's Health Chief says, don't just stick menopausal patients on HRT. It's not a very long one, so let's just quickly go through it. And it's saying medics should not just stick women on HRT during menopause, according to Women's Health Chief, because prescriptions for the drugs which can relieve menopause symptoms have soared amid high-profile awareness campaigns backed by celebrities and on-air personalities and all these people that we see on our screens and influencers. But according to the NHS's first national clinical director for women's health, Dr. Suman, there is now a perception that everybody should be on HRT, and that menopausal women feel they are missing out if they are not prescribed the medication. So, I think it's really important to have that. That's what I meant about let's walk this back a little bit, because the purpose of menopause treatment is not as soon as we say, oh, you're menopausal. The purpose is not that we just stick you on HRT and then off you go. That's not it. There's a full assessment that you need to have. And that assessment determines, okay, fine, this is menopause. What are your needs? What are the issues? And how best can we treat them? There's some things that HRT is not going to help with. In fact, the symptoms that HRT is most effective with are hot flushes and night sweats. It is very effective in doing that. Which if somebody is suffering from those to a very, horrendous degree, of course, they should have HRT. but it may not be effective for other symptoms. And so what else would happen? But before we even get there, in that conversation about treating and managing you with any menopausal symptoms, your doctor would want to look at lifestyle, would want to look at diet, would want to look at exercise habits, just to, one, help to control your weight, but also two, just to help to maintain your heart, maintain your circulation, maintain your bones, maintain your mental health as well. So those are key considerations. And it's not just, as soon as you get somebody and, they're having menopausal symptoms, then, get them on the HRT. But let's read on, what Dr. Mann says. In an interview with the Times, she said, HRT used by 2.3 million women in England is not a one-size-fits-all solution for health problems in middle-aged women. And symptoms can be part of a complex, difficult life that maybe medication won't solve. Absolutely correct. Okay. So, let's just see. So she's going on to say menopause is a time of life. There's a lot going on. That's true. Women have other things going on. And so being very linear about it and saying, oh, we'll just give you some HRT. No, that's not empowering. Okay. And just like I've said, HRT can be very brilliant with some symptoms like hot flushes, but it shouldn't just be handed out automatically. Okay. So we should be thinking about everything else that's going on in a woman's life and looking at what is the role of those particular situations, possibly on how she's presenting, because that would help you to deal with it. I think the worst thing actually is for you to give somebody HRT and they go away, come back after 6 weeks and know better or worse. Then we're in a bigger pickle. So that's why it's good to get it right. And, a worrying thought as well. Earlier this year, according to this report, a paper published in The Lancet suggested that menopause, The Lancet is one of our journals, suggested that menopause was being treated like a disease. Oh, gosh, to make money for pharmaceutical companies. Right, this is a difficult one because I know there'll be lots of people who will say, yes, doctors are quick to give HRT because they make money. On the NHS, it doesn't work like that. That doesn't happen. Okay. Researchers said a medicalized view of menopause meant that countries like the UK were treating it as a medical disorder or hormone deficiency that required treatment when it was part of healthy aging. And experts from King's College London and the Royal Women's Hospital in Melbourne, Australia, said too many health problems were being blamed on menopause without evidence to support it. So yeah, I think there's I think that menopause is aging, okay? There are many women who don't have any distressing symptoms of menopause. So I see where we're coming from, not to label it as a health condition like hypertension, for example, because menopause is a natural aging process, but there are some women who will have menopause symptoms, distressing menopause symptoms that do require treatment. And I agree that sometimes because we think menopause can affect different parts of the body in different ways. I mean, last time, I'm sure I've come across an article with over 60 menopause symptoms. So if you sit down, you can actually work out how menopause could affect different parts of the body and affect women differently. And that goes back to what I was saying at the beginning with that first feature about how the ovary is not just a reproductive organ. It's like the pacemaker for aging. It's also a ticker. It's also a marker for wellness, well-being in a woman, not just for fertility. But I don't want to digress. I think the point that we're trying to make here, and for you watching or listening and thinking about menopause, as you should be doing, whichever age you are, just be aware. Even if you're in your 20s, be aware. Even if you're in your 30s, at least be aware. But as you go into your 40s and 50s and are thinking about menopause, especially if you have symptoms, or somebody who has, it's holistic. It's not just taking the hormone replacement therapy. It's thinking about everything else going on and just trying to marry all the different therapies together. So whether it is the HRT that's needed, whether it is looking at what type of, what's your social construct? What do you do? Are you under a lot of stress at work? Is there a possibility to delegate? We talked about this last week when we were looking at menopause fatigue and, how to de-stress and different things. We mentioned HRT, but not really as a large component of dealing with these symptoms. And I think that is what is so important about this conversation, and especially for us clinicians, but really important for our patients to be aware of as well, that you don't just go into the doctor's room and expect that the answer will be just that prescription. It's more complex than that. There is a lot more involved, and we should welcome a discussion to see what else can I do. Should I be thinking about losing some weight to help my joints feel and work better? Should I be doing some more working with weights, in terms of exercise to help to build up my muscle strength, and then help to support my joints? What else can I do in terms of diet and the food that I eat to contribute to helping to support my bones, and everything else that goes into that kind of conversation. So that is that about that particular feature. So yeah, I've got one more segment I want us to look at. This is the viewer's question, and it's a really interesting one that I want us to address. Again, let me know what you guys think about these conversations that we're having. I'm also open to hearing from you. If you've observed something that you're concerned about, something that's happening around us today, and wondering, where are we going with this? What are the possibilities for this? Please let me know. You can send it through the community post, or you can send it through our email service, or the email on the channels. I've got them both in LinkedIn and YouTube and Facebook, so you should be able to find them, or in response to one of my more recent videos, and I'm sure we'll get back. It might be something that we'll look at in a future live stream. So let me just take a quick break, and then we'll go to the viewers' question for this week. Okay, so have you answered the poll, YouTube? YouTube guys, have you answered the poll? Please answer the poll. Let me know. I wonder if I can have a look. Let me just take a quick look. So let me put on the viewers' question while I have a quick look at YouTube and see if anybody's responded to that poll, and see how that poll's doing. So this is the viewers' question of the week. Let's see. Okay, so for some funny reason I can't see the poll, but never mind, we shall carry on. So now we're ready to tackle this question. Okay, I don't know if you guys can still see me, because I'm not sure what's setting, but anyway, let's deal with the question. Thank you so much to the viewer who sent in this question. Thank you so much for your interest and commenting on the video. She says, can having a fibroid cause bleeding such that I will not enter menopause, or make it 12 months without bleeding? I'm 51 and deciding if I should get a hysterectomy for my fibroid or wait. My biggest fear is that I'll just keep bleeding unpredictably. Okay, I'll leave it on for a few minutes more. Anybody who's just joining to go through that. Of course, if you have a question, always happy for you to send it on to one of our videos. Most recent videos usually the best, especially if it's related to the topic, and then it's something that I might pick up and we can have a conversation about. So I like this question because it addresses something that as I said, I think I've done a video about this, about fibroids and menopause. We used to think that fibroids shrink around menopause. That's not always the case. Many women who still experience troublesome fibroids as they get into menopause, and after they've entered menopause. So it's not always the case that they will shrink. And don't forget that fibroids, really are more common as we grow older. Okay, but this question addresses, one of the issues. When we make a diagnosis of menopause, we say that it is when you've not had a bleed for 12 consecutive months. That's the definition of menopause clinically. So we don't usually go and do blood tests. It's not like being pregnant that you do a blood test and your beta HCG level is this, that, and that tells you definitively that you're pregnant. No. Usually, and especially here in the UK where I practice, usually in a woman who is maybe in her mid 40s, late 40s, approaching 50, who's coming in with symptoms that we recognize as menopausal symptoms, like hot flashes or night sweats, we wouldn't generally, especially if she's well, and there's nothing else. When I say well, I don't want to say, oh, how do I put it? I don't mean that hot flashes and night sweats don't make you feel unwell. I just mean it's not something that we consider to be an acute, life-threatening concern. When we add that together with experiencing irregular bleeding, then we will say this person appears to be around the menopause or perimenopause, and by the time she doesn't have any more bleeding and it's been a good 12 months since her last bleed, then she is in menopause, and then we don't do any blood tests. Simply we use a clinical diagnosis. That's what that means. But this lady in this question is saying that, how am I going to experience 12 months without bleed when I have fibroids? That's the question that's the problem that she's got. And let me answer that first, because you can have those two things happen together. The fact that you have fibroids does not mean that you will not go through the menopause. What is causing menopause is a decline in your ovaries function. That is what is bringing menopause. That's what is causing the menopause to happen. Your ovary function is declining. Estrogen and progesterone levels are slowly declining. And so the argument is, well, so fibroids that we have always said are related to those hormones, why aren't the fibroids shrinking? It's a lot more complex than that. We don't know exactly what causes fibroids. We know that hormones are associated, but we think that there are other things involved in the fibroids development. But I don't want to derail too much, otherwise we won't answer this question properly. So the point I'm trying to make is that it is possible that you are undergoing menopause and your ovarian activity is declining and you have fibroids, and they may be causing irregular bleeding. So to answer the question, can having a fibroid cause bleeding such that I'll not enter? No, it's not. Having the fibroid is not going to prevent you from entering the menopause. Your menopause is going to happen because your ovaries function are declining. The fibroids, which are abnormal, which are benign growths of your womb, they're not going to affect the function of your ovaries. They're not going to stop the ovarian decline. Of course, they're going to cause troublesome bleeding because their presence is disruptive to the whole anatomy and structure of the womb. But they're not going to prevent that effect that your body as it ages will experience. So that's the first bit of that question. And then she says, I'm 51 and deciding if I should get a hysterectomy for my fibroid or wait. My biggest fear is that I'll just keep bleeding unpredictably. Okay, so, I thought that was a really, question that somebody has really gone and thought through. And after thinking about it a bit myself, I had a conversation with my colleague, and Dr. Tolu, people have met her before on a couple of videos in the channel. Those OGs, my OGs on YouTube are familiar with Dr. Tolu, who is our gynecologist's colleague who pops into the channel once in a while. Okay. And we had I wanted to get her opinion about this and a few important points that she made. Now, I've just been explaining to you about how we don't routinely do blood tests to diagnose menopause, which is true. And the only time that we do it is if we're faced with symptoms and we want to be completely sure that what we're dealing with is menopause or it's not menopause. So for example, somebody who is quite young and who is having symptoms that look like menopause. So somebody who walks in about 30, 35 and they're having hot flashes and irregular periods and things like that, you want to sort of look at the hormone profile. So you will do those blood tests. But for somebody like this, and this is a recommendation from my gynecology colleague, somebody like this who is presenting at this age, and even though it looks as if it's menopause, you want to be sure that is what you're dealing with. So she says the average age of menopause is between 48 and 52, and it's possible that the symptoms are pretty much fibroids causing troublesome bleeding, and you're at the right age for menopause. However, it's important to do a blood test just to make sure that menopause is happening. And by the time at that age, you would expect to see a menopausal picture from those blood test results. Younger than that, it may be confusing, which is why we don't do it routinely, because the levels don't just zoom just like that. They sort of tend to bob up and down as they're reducing. So sometimes they can create a picture that's difficult to interpret. So a blood test is what is suggested, just to see, okay, this woman, yeah, she's in the right age, this seems like menopause, but the blood test sort of gives you a confirmation for that. So that's one suggestion. The other thing that she said that was pretty useful as well, and again, this is why we usually don't want to specifically give any advice or anything for anyone on this channel, because it's not the right thing to do, and there isn't much information that you can actually do it safely or ethically. The other thing that's important to do is, she said that she's got fibroids. Okay, fair enough. But any bleeding, I don't know when last was she scanned. When were these fibroids diagnosed? Were we sure that it's the fibroids alone causing the bleeding, or it's not the fibroids but it's something else? So what the gynecologist suggested as well is, an urgent assessment, because especially if you're menopausal, this is now what we call post-menopausal bleeding, and it's something serious, because when you're at menopause, you're not expected to have vaginal bleeding anymore. So she's saying that she's got fibroids. I don't know how long she's had them for, when this last scan was, and so on. So many questions that we don't know the answer to. But it's also important to have a look at the womb lining and to check that there's nothing else that's responsible that is causing the bleeding that she's experiencing. And that can be by doing an ultrasound scan, or there can be a biopsy where they use a little instrument to get a bit of tissue of the womb lining, inner lining, study it and decide what is responsible. And important to do those things before we now have that conversation about hysterectomy, which is the last part of her question, where she says, I'm deciding if I should get a hysterectomy for my fibroid or wait. I mean, the decision about hysterectomy is one that should be very carefully considered. It's not just, oh, well, she's in her 50s and she doesn't need it anymore. I mean, I don't think that's an appropriate way to have that conversation, because any kind of surgery carries its risk with it. So it shouldn't be done just for the sake of doing it. It should be that, well, this is the best and most effective option for dealing with this problem. And you can only come to that decision after you've had a conversation with your doctor, with your specialist, and looked at the symptoms, looked at your medical background, and looked at the options that are now left in terms of treating whatever it is that you're dealing with. And my gynecology colleague finished up by saying, hysterectomy comes with its challenges, its risks, and recovery after surgery. Really important to have that conversation with your gynecologist to make up your mind. So I will send this segment of the video I will send the video to the lady who put in that question. But again, thank you. I hope this is helpful. I hope this helps you sort of sit down with your doctor to share your concerns and ask for more explanation about what's going on and what they think and what else they would suggest. And that brings us to the end of today's live stream. I know we packed such a lot into it, but I hope this was interesting and useful. Please send me ideas. I want this to be interactive, not just for me. I love sitting down and having this conversation with the channel, with viewers, but I also want it to be something that you'll find useful, that you can sort of take away and say, right, I've really had a useful educational discussion with me. So let me know what ideas or thoughts you have, what you'd like us to cover in future videos. Don't forget to check out the videos on the channel, like I described some of the most recent ones. There's always something new. I'm really happy with the fact that we're able to provide something new, something different, lots of different videos on the channel. So I hope that you go and check them out, and let me know what you think about them. Let me know which ones of tickle your fancy, and which other ones that you'd like us to show. Thank you so much for supporting the community posts and engaging with the community posts. I love making them, and I know lots of you enjoy doing them. So thank you so much for that. Guys, we've come to another end of another stream. I hope you have a great week. I hope you join me again next week, Sunday. But before then, or in between that time, different ways to get in touch. Use our email health information service. We have different platforms on X, Twitter, Facebook, LinkedIn, Instagram. Hit me up. Talk to me. Use the AskAwayHealth email information service if you've got a medical question that you'd like some guidance or some information around. And yeah, look forward to hearing from you in any one of those chapters or platforms. And I'll see you again soon. Bye-bye.